One of the greatest challenges confronting doctors during the peak of the 2016 Zika outbreak was the urgent need to treat patients presenting with neurological complications that, at the time, were not fully understood. Thanks to the scale and scope of the Zika Preparedness Latin American Network, Zika Plan, a consortium hosted by Sweden's Umeå University and led by scientific coordinator Professor Annelies Wilder-Smith, alongside project coordinator Dr. Roman Preet, which galvanized links between clinical research teams in multiple disciplinary and geographical regions, enabling some of the world's leading neurologists to join forces with the Brazilian Neurology Association to provide the knowledge, resources, and tools that saved lives and paved the way for a more rapid response to future outbreaks.
So we have been investigating the Guillain-Barre syndrome already for decades as a national expertise center for research in this disease. Very important is the international Guillain-Barre outcome study that we have initiated, and that is an observational cohort study in which we are collecting clinical data and biosamples. The importance of that study is that we are trying to find predictors for the clinical course and outcome of individual patients. The Guillain-Barre syndrome is a relatively rare disorder with an incidence rate of about 1 to 2 per 100,000 per year. And because of that rare incidence, it's very important to collaborate with other countries to have sufficient number of patients and expertise on board to do the research. In 2015-2016, when there was an increase in the reported cases in Brazil, we were asked to lend our support as experts in this research of Zika Plan. And then we used the ICOS infrastructure to collect clinical data and biosamples from the patients in those countries.
A detailed examination of GBS cases and controlled studies from Brazil, Argentina, and Malaysia, alongside extensive literature reviews, provided the evidence that was needed to hasten an effective clinical response. In a study that was set up during the height of the Zika virus epidemic in Recife, northeast Brazil, by Dr. Maria Lucia Brito, the team found that 68% of the GBS cases had been exposed to a prior arbovirus infection. Most of these cases had evidence of a prior Zika virus infection. Interestingly, 17% had evidence of chikungunya virus infection, a viral disease transmitted to humans by infected mosquitoes, and 29% had evidence of both chikungunya and Zika virus. Those with evidence of a recent infection with both viruses seemed to have a worse disease progression, with higher rates of ICU admission. As more evidence was amassed, clinicians were able to identify and diagnose patients, while at the same time shed light on the pathophysiological mechanism of GBS, something that had previously been modelled in the lab and now was being tested and treated at scale. Whereas before, diagnosis of GBS had tested the scientific and clinical models available, owing to its characteristic heterogeneity, the variability in clinical data. The rigorous response channeled by the Zika Plan led to the development of an extensive database. The Zika virus epidemic and the increased incidence of GBS cases also revealed the lack of international guidelines for the diagnosis and management of GBS. With help of the networks established by Zika Plan, the consortium members were able to write the first international consensus guidelines for GBS. These guidelines were developed to ensure international applicability and to be user-friendly with a step-by-step approach. Dr. Sonja Leonhard was part of a global team of more than 100 experts assigned to the task.
We quickly became aware of the challenges that local neurologists were facing, not only in doing research but also into managing the increasing amount of neurological patients that they were seeing. And we were impressed with the way that they were handling this. And this was an invaluable insight into the challenges that colleagues from low-resource settings are facing during these epidemics.
Responding to the escalating cases of GBS was a truly global effort, involving experts from Brazil, Colombia, Asia, America, Oceania, Africa, Bangladesh, China, Malaysia, and South Africa. Pooling data with the insights of statisticians, laboratory technicians, research nurses, physiotherapists, epidemiologists, and neurologists, the resulting toolkit is part of Zikaplan's lasting legacy, providing as it does a robust framework for the global management of GBS. It has already been translated into Portuguese, with Spanish and Mandarin versions in development.
It's great to see that out of this global crisis that this intense collaboration emerged, which was instrumental to develop clinical guidelines for the diagnosis and treatment of the Guillain-Barre syndrome. And I'm pretty sure that these guidelines will be used worldwide and are very important also for the future when new infections will emerge that may also be related to the Guillain-Barre syndrome.
Characteristic to scientific progress, questions still remain about the pathophysiological mechanisms that might shed light on how GBS is triggered by Zika virus, or indeed by other virus infections. The evolving nature of the disease will invariably necessitate further studies. The example and baseline set by the Zika plan will continue to play a pivotal role in this. Further collaborations have already transpired, involving researchers from Singapore, Colombia, and Peru. In one case, helping a local neurologist to identify the cause of a large outbreak of GBS cases in Peru in 2019, as connected to the bacterium Campylobacter jejuni.
The whole experience was enormously enriching for me, both scientifically and also at a cultural and personal level. And I was very much impressed with the way the Brazilians were so hospitable to me, and that we were able to unite in an overarching aim to improve the lives of people with neurological disease.